For the second time in 3 years, the World Health Organization has declared mpox a global health emergency. Previously known as monkeypox, there is a new, more deadly strain of it spreading across parts of Africa. The number of mpox cases reported so far this year is already higher than last year, with more than 1,700 cases and just over 570 deaths. Joining us for more on this is Kiffer Card, an assistant professor of health sciences at SFU. Kiffer, first of all, what led to the WHO declaring mpox a global health emergency again, and what do we know about this strain?
So typically, mpox cases are mostly zoonotic, meaning they come from animals, and then spread only within, say, a household or a small area. Is what we're seeing with this new strain is kind of sustained human-to-human transmission, in which it's spilling not out of the Democratic Republic of Congo and into surrounding countries, and even a few international cases have been identified. So it really suggests that the more virulent nature of this strain is a cause for public health concern, that potentially this could spread outside of African countries, potentially into Europe, Asia, and the Americas. And so it's mostly around that idea of the infectious nature of this strain that is worrying public health officials.
And remind us, what are the symptoms and how dangerous is this?
So mpox typically causes flu-like symptoms at the beginning, and then a rash forms typically across the bodies or in the genital area. And these form into painful scabs. So it's a really unpleasant condition to have. Typically, the fatality ratio is quite low. About 1% of people who acquire mpox, are likely to die. With this new strain, it's looking like that's a bit higher, 3.5%, 4%. But some outbreaks of this specific lineage have been known to kill as many as 10% of people. Particularly a challenge is that diagnosis is typically not occurring until symptoms begin. And that's about 2 to 3 weeks after exposure. So you could be exposed, and it might take a few weeks for these symptoms to appear. But they begin like flu-like, and then they move on to that scabs on the body.
Now, the last outbreak in 2022 spread primarily among gay and bisexual men. Is that the same with this strain too, or is it different?
Yeah, typically close physical contact, skin contact, and contact with the fluid coming out of either saliva or out of the scabs on the body, or the bedding and those sort of things is how it's transmitted. It is possible for it to transmit on surfaces, but again, that's not the typical transmission. It's also possible for it to transmit through direct face-to-face contact over a prolonged time. So those features kind of made it more common through sexual contact, nightclubs, and that sort of thing. And so we did see that it was primarily amongst gay and bisexual men. Is what we're seeing now with this new strain coming out of Africa is it appears that the sexual contact isn't really required. It's hard to know how this is going to play out on the world stage because previous infections were not typically in Africa transmitting only amongst gay and bisexual men, like how it played out on the world stage. And so we'll really have to watch to see how this epidemiology might differ with this new strain once it is, or if it starts transmitting in other countries outside of Africa.
And quickly, we appreciate your time. There is a vaccine. How effective is it?
Yeah, fortunately, we do have a vaccine. So the priority right now is to get those people who are at greatest risk, which are the people living in countries across Africa, the vaccine. It's effective even with just one dose at about 86%. At 2 doses, it's pretty effective. And then if there are breakthrough infections, the vaccine does significantly lower the severity of illness. And so it's something that we really want to get into the hands of people who need it.
Okay. Kiffer Card from SFU, we appreciate your time. Thanks for joining us.